I'm Sebastian, naturopath and biochemist. In this episode, you will learn how the novel coronavirus spreads. Understanding the transmission of the novel coronavirus is key to understand which measures are actually effective in limiting the spread of coronavirus disease. Before I come to all this, I need to introduce some terminology. You have probably heard already two expressions for the virus, which is COVID-19 and SARS-CoV-2. COVID-19 actually means Coronavirus Disease 2019, and this is the expression you use for talking about the disease, the coronavirus disease. In the future, I will use coronavirus disease or simply COVID-19 when I speak of the coronavirus disease. The novel coronavirus itself has a name, and this name is SARS-CoV-2. That means SARS is severe acute respiratory syndrome, and then CoV-2 means coronavirus 2 because it's the second of this SARS viruses. So how do you actually get infected by the novel coronavirus? The novel coronavirus can enter your body via your mouth, your nose, or your eyes. If you want to understand how the virus spread, you have to think of a contagious person who's spreading the virus. Contagious persons spread the virus via breathing, talking, sneezing, or coughing. All this can be also called exhalation because it's always in combination with exhalation. The transmitting carrier, if you want so, always is the contagious saliva, and this is actually spreading from an infected person to another person in the form of droplets, or very fine droplets, which are also called aerosols. There are two ways how the virus spreads to another person, either via hands or via the air. So if an infected person exhales or speaks, will produce drops or droplets, and these drops or droplets sink down and land anywhere around this person on objects and surfaces, and later on these surface or objects are touched by the hands of a non-infected person, and the saliva gets on the hands of the person, and then the person touches mouth, eyes, nose, and gets infected. Another way is via the air. Obviously, not all drops or droplets fall down directly in front of you. And then also, if you have someone standing close to you, it might happen that if you speak to a person and you have a close contact, that these drops that come out of your mouth are directly landing on someone else. And that can be like on their clothes, but it can be also into the face, or well, something that probably doesn't happen anymore in these times is that someone actually coughs into your face. I mean, you should always cough into your armpit. So that would be a direct way to get infected. The other possibility is that if someone, especially if someone coughs or sneezes, there are very fine droplets actually created, and these can form something which is called aerosol. And an aerosol is like, well, a natural aerosol is fog or mist, or even the clouds in the sky. So this is how you can imagine an aerosol. And if an infected person with his contagious saliva sneezes or coughs, that produces an aerosol which is standing in the air like a cloud and can then be inhaled by another person. And this person, of course, can become infected too. These two ways of infection, via the hands indirectly or via the air directly, are already showing you why physical distancing is so powerful to limit the spread of the disease, because when people are 2 meters away from you, it's not like easy for you as an infected person to actually spread your contagious saliva on this person. Also, because contagious saliva of an infected person might stick to your hands, it's really important that you stick to the hygiene measures, especially washing hands, but also wearing breathing masks. A question that is frequently asked by people is, how stable is this contagious material actually that lands on surfaces? And there have been done some studies on that, showing that the novel coronavirus remains viable on surfaces for several hours, up to 3 days actually. So on copper surfaces, the virus remains viable for 8 hours, but on cardbox and steel, it's up to 1 day, 24 hours. And on plastic surfaces, it has been shown that the virus stays viable up to 72 hours. That means 3 days. Another question that many people ask is, what is actually an aerosol? Transmission via aerosol is typical for a number of viruses, for example, the measles virus. It involves some kind of a cloud that is formed when a person exhales. And it has been shown on studies, specifically on the novel coronavirus, that if these clouds are formed by exhaling from an infected person, the contagious virus can actually stay in the air for up to 3 hours. And it can also enter ventilation and climate control systems, which might be actually something we're not really talking about it right now. But imagine in a hospital, of course they have some kind of ventilation system. So there's a possibility also that the virus spreads via the air in an air condition. And that's something I think is really important to mention. It's interesting because the flu doesn't do this. The flu is rather like something which comes via the hands, although it's also something which is like, a respiratory disease. But in this regard, the novel coronavirus behaves pretty much like a measles virus. So if you put 100 people half an hour into a room with one person that has measles, 99% of these people will get it, although they are not in close contact with this person, which shows that it goes via air and most probably also via aerosols. So the third question that always comes up in this regard, we are talking about the spread of disease, is how contagious is the virus? And the novel coronavirus is apparently very contagious. Otherwise, it would not have spread from Wuhan, China, to the whole world within a couple of weeks. Right now, on average, one infected person is supposed to infect 2 or 3 other people if there are no hygiene measures or physical distancing. The infectious period, that means the time when a person that is infected is actually spreading the disease, is already 2 to 3 days before this person shows symptoms, and then for at least another 8 days. And this is also really important because this is quite unusual for respiratory viruses, that they already are contagious before the person has symptoms. And it's also very well known that there are even people that don't have any symptoms. They have basically a disease that is not showing up, but they are still spreading the virus. And this is actually a call for breathing masks. It's a call for educating the people that they are washing their hands, because you could be infected and contagious without knowing it. And then if you don't stick to the hygiene measures and to the physical distancing, it might happen that you will be infecting way more than just 2 or 3 people, maybe 10 people, maybe 50 people, depending where you are. So for these reasons, I think with regard to exiting lockdown, it will still be very important that we are not gathering in huge groups, that we are wearing masks, and that we are sticking to other hygiene measures like washing the hands. This is really important, and this is, in a way, a social requirement in order to keep our society up and living. Because right now, everyone sitting in the house, people losing job, this is not life. If you catch the disease from someone, the time until you actually develop symptoms is called the incubation period. And this is usually 5 to 6 days, but can be anywhere between 1 and 14 days. This is also important to know. It will be also very important to use this knowledge in so-called tracking apps for mobile phones that could actually inform you whether you have had contact with someone who had a positive test afterwards, because I said it can take another 2 or 3 days until this person develops symptoms. And then you could get actually a message from this tracking app telling you, okay, you've been in contact with someone who was diagnosed with COVID, and now you better stay at home and you take all the measures that you are not actually infecting someone else. So this will become really, really important for us to exit lockdown, but also to finally end this pandemic. I hope it has become clear that understanding the spread of coronavirus disease is essential to understand that the measures of physical distancing and hygiene measures makes totally sense. And also it has become clear that certain hygiene measures are more important than others. I will discuss the most important hygiene measures in this next editions of this series of videos.